I thank our witnesses very much for your testimony. I apologize, I had to step out to a banking committee for markup vote for much of it, but I have read your testimony and I'm very familiar with your statements and your perspectives. I'd like to start out, Dr. Holtz-Eakin, with you. Your testimony touched on the different ways that Congress could reimagine the complex network of the federal government healthcare subsidization put in place also needed reforms for the Obamacare market. You further outlined various tax-advantaged healthcare accounts and tools that already exist in the tax code, each with unique rules and benefits. Would you expand on the concept of delivering financial assistance through health savings accounts, especially for those enrolled in bronze and catastrophic plans?
Certainly, Mr. Chairman. I think it's important to think about that in two different ways. The first is that, as I said in my opening statement, for the 2026 plan year, your options are very limited. There are people who have enrolled and they have a bronze plan and an HSA, and you could appropriate additional funds to put in that to help them deal with the costs that they're facing in this plan year. But not everyone's got one, so you can't get to every beneficiary that way. So in the near term, it's fairly limited. Beginning with the next plan year, that's an attractive policy because we've done some work. We have a microsimulation model of the under 65 market, and if you put, for example, $4,000 in an HSA for everyone who has a bronze plan, you lower the cost compared to having premium tax credits. It's attractive from a budgetary point of view. You see obvious migration to the bronze plans and people using the HSAs to manage their finances, and you get reductions in some of the premiums. So that's something that I think is worth consideration, and be happy to work with the committee with different variations on it.
Well, thank you very much. And Mr. Blais, you developed the concept of funding cost-sharing reductions, or CSRs, and depositing those dollars into a health savings account. I realize that's probably the Health Committee jurisdiction, but could you elaborate on this proposal? Could you also share with us information on how you would increase access to HSAs on the exchange?
Sure. Thank you, Mr. Chairman. So the ACA had two subsidy programs. It had a subsidy program that reduced the amount of premiums for enrollees. It had a separate subsidy program for lower income enrollees, which is about 2/3 of enrollees, that reduced their deductibles, co-payments, and out-of-pocket payments. The issue was the ACA wasn't written particularly well, and there wasn't a valid appropriation for the cost-sharing reduction program. So federal courts ruled that the Obama administration was making illegal payments through the CSR program. The Trump administration complied with that ruling. The CSR payments stopped. What insurers did in response was significantly increase the premium that the subsidy is tied to. So by doing that, premium significantly increased, and the premium subsidy significantly increased, and the total subsidization went up. What a CSR appropriation would do is significantly lower the benchmark premium. So silver plan premiums would come down 12%, and that would reduce the federal subsidies as well. So it's a way to lower premiums and reduce federal deficits by $30 billion. What we have developed with the HSA option is that enrollees, they would still get the premium subsidy, but they would be able to take the CSR subsidy under their control. They'd be able to get it as an HSA deposit. And Milliman analyzed the benefits of the HSA option and found that about 70% of enrollees would be better off if they took that, had the government subsidy into an HSA, and the annual benefit for them would be about $1,500.
Meaning that would be a much better solution for them than to have just a direct COVID-era subsidy.
That's right. It would replace the subsidy that goes directly to the health insurance company, and the individual would get the option to take that under their control as an HSA.
And you get that 12% reduction in the premiums.
The 12% reduction in premiums would be silver plans across the board.
Thank you very much. And my final question for you, Mr. Blaze, is you mentioned other ideas to increase affordability in your testimony, and these reforms are necessary to deliver broad-based, diverse options for all Americans. The one-size-fits-all nature of Obamacare has been a significant driver of increased consolidation and decreased competition and choice. And I would just like you to discuss that concept very briefly. I'm almost out of time.
Sure. So there's options that were developed in the Trump administration to help small businesses, to allow small businesses to join together through association health plans to gain the same regulatory advantages that large employers receive. It really doesn't make any sense that federal policy discriminates against small employers in favor of large employers. There's other options like short-term limited duration insurance, which I know Idaho was very successful in Idaho. That's comprehensive insurance. Has much broader provider networks than ACA plans at a fraction of the cost.
Well, thank you very much. We appreciate your expertise here. Senator Wyden.